All right, everybody, welcome back to the Jordan Report, and I am your host, Robert Jordan. Everyone, please remember to like, subscribe, and share. All right, guys, I have several family members who happen to be healthcare workers in Southern California, and I have sent them articles and given them my opinion, told them do not take the vaccine. So I would like to take credit for this, but unfortunately I can't. But anyway, here's what's going on in Southern California with the COVID vaccine. The majority of Southern California nurses refuses the COVID vaccine. This was December 16th, okay? A number of local healthcare workers have reservations about the COVID vaccine authorization for emergency use, according to the survey from UCLA Fielding School of Public Health. 2/3 of the healthcare workers that we surveyed wish to delay the vaccination or not get vaccinated. That's what I told my family members. Do not get it. She said the survey collected data from about 600 workers between mid-September and the end of October. Okay? So in California, the healthcare workers, the nurses are saying no. Now let me tell you why it's good for them to say no. This is what came out of Anchorage, Alaska today. Okay? This is, again, the first day of the vaccine. Alaska healthcare worker hospitalized overnight and another received brief emergency treatment after COVID-19 vaccine. Now, there's reports of 2 nurses dying. That's unconfirmed. If that's confirmed, I will report it. But that's what's out there right now, okay? A Juneau healthcare worker was hospitalized and treated for a serious allergenic reaction after receiving the COVID-19 vaccine Tuesday. Hospital and health officials said Wednesday morning. Wednesday evening, hospital officials reported that another healthcare worker who received the vaccine at the hospital that day received brief emergency treatment as well, but did not experience anaphylaxis, or what is known as life-threatening allergenic reaction. Okay? Multiple healthcare workers and officials on Wednesday were adamant about the importance of people continuing to receive the vaccine, and the state's top health officials said no changes to the vaccination plan were expected. The Juneau worker felt flush and took an antihistamine around 10 minutes after receiving the vaccine Tuesday afternoon, authorities said. She felt short of breath and was transferred to the emergency room, said Dr. Lindy Jones. Upon arriving at the emergency room, where Jones was the attending physician, the worker had an elevated heart rate and a red rash on her face and torso, he said. Jones began treating her for anaphylaxis, or I'm not going to say that one, and more antihistamines, which she responded to. But her symptoms began to reemerge, he said, and she was treated with more of this stuff as well as steroids. When providers tried to wean the worker off of it, her symptoms reemerged before resolving once again, Jones said. And she was then moved to a intensive care unit for observation overnight, he said. She was in stable condition and doing well. She was still enthusiastic about how she got the vaccine and that the benefits would give her the future, Jones said. People, don't take this vaccine. Let me show you the local news.
There's a report from the New York Times that there's been a severe allergic reaction from a healthcare worker in Alaska after receiving the Pfizer-BioNTech vaccine. Now, they report that this person is in stable condition, but the person had been hospitalized after this allergic event. They are citing 3 people familiar with this event. I've reached out to Pfizer for any comment and have not heard back yet, but we'll report back. Now, they're saying that it wasn't clear if the worker had a history of allergies, but they said that the event appeared to be similar to the anaphylactic reactions that 2 healthcare workers in the UK had after receiving the vaccine last week. Now you see Pfizer moving down there on this news. And guys, of course, this is something that the FDA and that health departments are monitoring as this vaccine gets rolled out, because we knew that after those 2 healthcare workers had these reactions, that this could be something that happens. And so the CDC has recommended that anybody who's had an allergic reaction to a vaccine or an injectable drug before not get this vaccine. Anybody with severe allergic reactions to anything else, food or drugs, should be monitored for 30 minutes after getting the vaccination. So guys, this report just coming out. We'll bring you any more news that we get on it, but that's the news for now.
Okay, guys, do not let an elderly person take these vaccines, okay? They will drop dead.